Hello, everybody. Thanks for coming back to the show. My guest today on this episode is Sunil Raina. He is a physician and a professor of community medicine at the Government Medical College in Tanda in India. You could listen to him on a previous episode I did if you want to backtrack and listen to what we talked about that day. In this episode, we run over a paper that he recently co-authored in which he covers the initiatives that have occurred in Uttar Pradesh in India and the My Village Corona-Free agenda. And I'll let the rest of the episode speak for itself, and I hope you enjoy this discussion. Take care, everybody. Okay, let's start off. You recently co-authored a paper, and you covered what occurred in Uttar Pradesh and the My Village Corona-Free agenda that went on there. So just sort of run over the content of the paper.
Absolutely, yes. You want me to talk about the paper as such and the initiatives that have happened in Uttar Pradesh. We can talk about that for a long period of time. But before we talk about the initiatives that worked in Uttar Pradesh, as far as the number of cases that have reduced over a period of time, we just need to focus on the paper first. Now, this paper was initially written for a group which is called the COVID Action Group, and we wrote the initial part of it maybe a month or so ago. And then we thought of bringing up a larger paper on this itself. Although the paper that you are quoting is not yet published officially on the WHO network, it may go to some other publications because of some issues that have cropped in. But the content stays the same, and the talk around stays the same. We have not changed that. And the success of Uttar Pradesh in being able to reduce the number of cases stays the same. Nothing has changed about that. But before we talk about Uttar Pradesh as such, we need to understand a few things. And we probably need to bring Uttar Pradesh in the real perspective or context of what is happening around the world. Now, I ask myself a question every time I talk about Uttar Pradesh and I talk about India. I ask myself a question. Could we have done better than what we did eventually, as far as this COVID is concerned? And if we could have done better, how would that have been possible? Now, the one answer that I generally come up with is the fact that obviously we could have done better, as could have most other countries across the world. Most of them should have been able to pick up the fact that COVID is going to be a big issue and it is going to kill a lot of people. So people around the world should have been able to pick up this as a huge event and should have been able to mitigate its impact as early as possible. But none has been able to do so. No country in this world can claim complete success as far as this pandemic is concerned. So we in India also don't claim a complete success as far as this pandemic is concerned. The second thing is that do I think really we could have done it differently? So that now I have the answer. Now, when I look at the success of Uttar Pradesh or I look at the success of some other parts in the country, I think we should have been able to leverage our strengths in the initial parts of the pandemic only. There were certain advantages with India which we didn't recognize probably at the beginning of the pandemic itself. Probably we were also a part of the system that believed in the fact that what everybody else is doing and that system of people doing it this way is going to work in India as well. But probably now I think that we had a better system. We had a better public healthcare system. We had better social service schemes in place, which should have been enunciated as early as possible. We should have been put in place as early as possible to make a better impact as far as this pandemic is concerned. We did lose lives, as did most of the countries across the world. But much more than that, despite the fact that we don't have the financial powers that most of the people around Europe or America have, we don't have that financial strength. And we don't have the technological advancements as is there in the Europe or the US, or we don't have the level of literacy that is there in other parts of the world, or we have a huge amount of geographic diversity that may not be there in other parts of the world. But despite those limitations, we have done well, in a sense that we have been able to keep the number of cases to a level which is manageable for a large part of the pandemic. It's not that we have been able to have them for small parts and for other parts of the pandemic, we have allowed it to run amok. It's not worked like that. for the large parts of the pandemic since March 2020, we have had it under control. It's not that it has overrun us, like it may have overrun other places of the world. So in that sense, I would claim that India has been partly successful in being able to mitigate the impact, control the impact of the pandemic, and able to keep the numbers to the lower levels that it has. Barring, I would say, the initial parts of May month in 2022, when we did really have problems. The rest of the times we have been able to keep it at a level wherein we have been able to manage it well. And of late, I would say for last 1 month across the country, and for last 2-3 months in Uttar Pradesh, we have been able to be successful in terms of the fact that we have been able to reduce the numbers to very low levels. If you look at the numbers in Uttar Pradesh, they come in single digits many a times. They don't exceed more than 15, 20. And if you look at Uttar Pradesh, the size of Uttar Pradesh, that is, these are very small numbers. We are in the phase of elimination if we talk of Uttar Pradesh. If you look at the rest of the country, barring a few states, say for example, Kerala, barring a state like Kerala, most of the states are showing lower numbers than for a long period of time now. So we have been able to contain it to small geographies in terms of the pandemic now. In that sense also, we can claim that we have been partially successful. But what Uttar Pradesh did and how exactly did it turn a crisis into a success is something that has been fascinating me over a period of time now. And as I said, the way we did it in Uttar Pradesh, we would have started it earlier, maybe we would have been able to do much, much better than what we eventually did now. Uttar Pradesh did all things that were being done by the country before the second part of the pandemic. Now, if you look at this pandemic since March 2020, I generally tend to divide it into two phases. I say the phase one, which in India was from March 2020 to the February and the March of 2021, the 1 year part of the initial phase of pandemic. And then we had the second phase of the pandemic, which started by the end of March this year, and eventually peaked in the month of May 2021, and then it started subsiding, and now we are in that second phase again. We are at a lower level now. So primarily I divide it into two phases, the phase one of the pandemic and the phase two of the pandemic. So what we did in the phase one of the pandemic, largely that was replicated by Uttar Pradesh in phase two, as was replicated by other parts of the country. So we had those restrictions in place, and we had those schools closed, we had the restrictions on shopping, and we had the restrictions on travel across states. So that was all done by Uttar Pradesh in phase two as well, as was done by other parts of the state. But there were certain initiatives that Uttar Pradesh began in phase two, which probably dramatically shifted the balance as far as management of this pandemic was concerned. So if we list them, if we think of listing them, these initiatives, I would say I would call them as initiatives which were there as a learning process of the phase one of the pandemic. So school closures was one. Restrictions on traffic was there. Restrictions on movement of people was there. These were all part of what we learned in phase one. Or use of mask mandate was there. So everybody moving in the markets had to wear a mask. Or social distancing, using people trying to stay apart from each other when they are moving around. Or for that matter, use of hand sanitizers, hand washing. They were all a part of what we learned in phase one of the pandemic. And this was done again in the phase two. And in addition to these, there were certain initiatives which Uttar Pradesh took, which, as I said, would have dramatically shifted the balance of management of this pandemic. Now, here I would also like to inform people who are listening to this or who will listen to this that if you look at Uttar Pradesh is a huge state. The number of people that live in Uttar Pradesh is in excess of 220 million. That's huge numbers. If you look at countries across the world, the size of Uttar Pradesh in terms of number of people it has is almost equal to that of Brazil. So it's a big state, not a very small state as compared to other parts of the country. We do have some small states with a population of around 1 million as well. But this is a huge state, and this state has huge population. But that's not the only reason only cause of concern with Uttar Pradesh. Uttar Pradesh is not counted as one of the states with the best of infrastructure. The infrastructure has dramatically improved over the past few years. but it has always been labeled as a country, as a state which didn't boast of the best of infrastructures in terms of, for example, healthcare or other facilities. And also the fact that Uttar Pradesh, unlike other states, other parts of the country, is still largely rural. It's not a state with huge urban population. So if you look at the urban population in Uttar Pradesh, it's around 22%. So rest of the population, almost 78% of the population in Uttar Pradesh is still rural, which is much, much higher than the national averages that we have. And there are other parts in the country, like say, for example, Maharashtra, which has higher urban population, or Kerala, for example, has higher urban population. But Uttar Pradesh is still largely rural. It's not an urban state. Despite the fact that it has some urban populations in terms of the fact that it has around 7 large cities which have more than 1 million population, but it tends to continue as a largely rural population. So we have a rural population with not the best of health infrastructure and not the best of level of literacy that it can boast of as compared to other parts of the country, but it has still been able to do well, largely, as I said, because of what it learned from its previous experiences from phase 1 of the pandemic, as also the fact that it did embark on some new initiatives in phase 2. So we start with what they did, what they learned from phase 1. So in phase 1, they learned that we need to go for a lockdown. So in phase 1, if you look at the phase 1 of the pandemic, India went into a national lockdown, which shut literally everything. So in phase 2, the government of India, as well as the government of Uttar Pradesh, thought of having a lockdown which is not as stringent as was in phase 1. So what they said was that we will shut down the state, the shopping process of the state, the movements in the state, will shut this down for weekends. So maybe by the end of Friday, everything will be shut down. So Friday evening, Saturday, Sunday will be closed, and Monday mornings can open up. In addition to that, they also thought that we will always have a night curfew in place, which means that nobody can move in the night. So you are restricting you are limiting the movement of people for weekdays, as well as the fact that they could move in the day. So that was one part of it, which was not as stringent as it was in the first part, and in the sense that we completely closed the state as such. This was primarily maybe driven from the fact that we wanted to ensure livelihood, which was a concern for us. And we were always being questioned of this fact that how does a poor country like India ensure livelihood in the adversity of a lockdown. So primarily this was one concern that we wanted to address, and may have been the reason for the fact that we didn't completely shut down as far as Uttar Pradesh is concerned. So that was one part of it. In addition to that, what they did was that they said that everybody who moves in the markets will need to observe the COVID appropriate behavior. Under that COVID appropriate behavior, what they said was that you have to have a mask in place when you are moving around in the daytime when you are allowed to move. And if you don't wear a mask, and if you are found without a mask, you will be penalized for it. So there has to be a monetary penalty for it if you are moving around without a mask. One. Second is that if you are not following social distancing, you again have to have a monetary penalty for it. So that has to be followed. And third, and the most important fact was that all shopkeepers were advised to follow these COVID appropriate behaviors. So anybody entering their shops without a mask was to be returned back, and he was asked to come with a mask. So this was something that every shopkeeper was asked to follow. And in fact, you would be surprised that for a large period of time, there used to be a police van which would roam around the streets of Uttar Pradesh and tell the shopkeepers to observe COVID appropriate behavior and shut your shops at around 7 or 8 in the evening when the deadline starts. So that police van would continuously blare through these loudspeakers and keep informing these shopkeepers to follow COVID appropriate behavior. So that was there as far as lockdown of this type was concerned, or restrictions of this type was concerned. In addition, what they did was that they put restrictions in movement of people from one district to another. As I said, Uttar Pradesh is a huge state. It has around 75 district units. Now, what does a district mean is that within a state, it has a geographical entity which is administered by a district magistrate, or what you can call as a district collector sort of a thing, or a district governor sort of a thing. So Uttar Pradesh has around 75 districts in itself. So that state is divided into these 75 districts. Now, what they did was that they asked people that if they are trying to move from one district to another district within Uttar Pradesh, they have to have an e-pass with them. E-pass was created for movement from one district to another. E-pass is the term for electronic pass. And for that electronic pass, they had to apply on the website of Uttar Pradesh government. So they would log on to the website, put their reasons for movement from one district to another. The state would see that this is a genuine reason and allow them to move from one district to another. And they had to carry that e-pass with them for their movement. In addition to that, in addition to the fact that they allowed e-passes for movement from one district to another, they also ensured the fact that within districts also, if somebody was moving from a zone of high cases, or what they refer to as containment zone, to a zone of low cases and non-containment zones, they had to have that e-pass to carry with them. So they had to apply for an e-pass within the district if they were moving from one zone to another, and they had to have that e-pass when they were moving from one district to another. In addition to that, what they did was, as far as traffic was concerned or travel was concerned, they put a restriction on movement of people from other states into Uttar Pradesh. So if we're moving from other states into Uttar Pradesh, you had to carry a negative RT-PCR report within last 72 hours of reporting at the border. So I say, for example, if I was to report today, I would have to have an RT-PCR report which was taken maximum 72 hours prior to my entry into the state. So that is something that they did over a period of time. And these restrictions were placed in the month of April and May only, when the numbers started increasing in the second phase of the pandemic. So this was with regard to the travel restrictions. This was with regard to the lockdowns, which I said may not have been as stringent as they anticipated, as was done in the first part of the pandemic. Now, in addition to that, they shut down the schools. The schools were closed down. So most of the people who wanted to have their education in the schools would receive it through an online portal system or online medium, through telephony or some other system that was worked out. So schools were completely shut down and were only opened by the end of August 2021. So for a large part of the year, the schools were shut down completely. They only started opening by the end of August 2021, when the number of cases in the state fell down to around 400. So when the numbers were high, the schools were closed down, restrictions were put in place, and movement of people from one place to another was reduced. And schools were not open all of a sudden, in a sense that all people would come to school in a day, and every type of schools will be open: the primary schools, the secondary schools, for that matter, the colleges or the universities. They were opened in a phased manner. So first, the 9 to 12th class students were allowed to go to the schools. The smaller kids were allowed to go later, and it was not made mandatory to attend schools. So even if you didn't want to attend the schools and wanted to receive education online, you could continue to receive education online. And anybody who wants to attend the school, it was made mandatory that only 50% of the students will be allowed in the classes. So if you had a strength of around 30 students in a class, only 15 were allowed. So not more than 15 were allowed at any point in time. And anybody who wanted to receive his education online will continue to receive that education online. So there was no bar on people had to eventually attend the classes. Without that, the education won't be received. So that was something that they also did. So probably these were things that they learned previously from their previous experiences. That was there in the first part of the pandemic as well. Therein also we had closed down the schools. We had put a restriction on the movement of the people, and we had put a restriction on the way people behaved in terms of COVID appropriate behavior, mask mandate. They were all there in the phase one of the pandemic itself. But what they did, as I said, as I keep referring to, in the part two of the phase, or the phase two of the pandemic, they learned certain things new. And two important issues that I continue to highlight, or two important issues that I want to reflect here, is one was the Mukhyamantri Bal Seva Yojana. So that was one thing which was exemplary in its operation. And two, the Mera Village Corona Free, or My Village Corona Free, Mera Gaon Corona Mukt. So that was the second part of it. Mera Gaon Corona Mukt, or My Village Corona Free. So these two are probably the game changers as far as Uttar Pradesh was concerned. We come to the first one first, the Mukhyamantri Bal Seva Yojana. So that was something which I said was exceptional as far as Uttar Pradesh was concerned. What they did in this was that they said that anybody or any child who loses a parent to COVID doesn't need to suffer from the impact of the COVID. So every child who loses a parent will receive a monthly amount of around 4,000 Indian rupees. 4,000 Indian rupees means around it's around $300.
Okay.
Not, but in fact, no, $600. No, it is $60.
Okay.
So something like that. So they will receive that on a monthly basis. As also the fact that they will continue to receive education free of cost. So the fact is that they don't need to suffer from education. That free of cost education will be provided to them by the government of Uttar Pradesh. And if they don't have a place to live, for example, they have lost their parents and now they don't have a place to live, they can be admitted in state-run institutions. So they have a place to live, which is run by the state-run institutions. This will be separate for boys and the girls. If they don't have the money to have their food, they will be paid this money. And if there is a guardian to take care of them, the money will be transferred to the guardian, who will ensure the fact that they receive their food. And if they are of the marriageable age, they have to get married. And now that they don't have anybody to take care of their expenses of marriage, the marriage will be solemnized by the state itself. So the marriage will perform all the activities of the marriage will be performed by the state itself. So this is something that was exceptional as far as Uttar Pradesh was concerned, because this at least put some positive inputs in the people who were suffering from COVID. I told them that no, here is a government which is willing to take care of the eventualities of COVID. So that's something that was exceptional as far as Uttar Pradesh was concerned. Second initiative that Uttar Pradesh did, and was largely in cohort with what the government of India did, was ensuring the fact that nobody in Uttar Pradesh suffers from the fact that they don't have a livelihood, they don't have food to eat. For the details on this, I would just like to refer you to something before we come to exactly what they did. Was that Government of India follows a policy which is known as Antyodaya Ann Yojana. This is a scheme which provides subsidized rations to people who are below poverty line. So roughly around, I would say, 25 million people in India receive these subsidized rations, and the subsidy is of the level that 1 kilogram of rice or 1 kilogram of wheat costs them around 3 to 4 cents to these people. That's very small amount of money that they need to pay for this ration, which is provided to them throughout the year by this scheme, which is there in the Government of India. Now, what the Government of India as well as the Government of Uttar Pradesh did was that they extended this scheme to a large number of people. So initially, if we had 25 million people receiving this benefits of this population, now Government of India is extending the benefits of this scheme to 800 million people across the country. The Government of Uttar Pradesh is extended this scheme to around 150 million people across the state of Uttar Pradesh. 150 million in Uttar Pradesh are receiving the benefits of this scheme, while 800 million people in India are receiving the benefits of this scheme. Now, the fact is that at this point in time, the people who receive the benefits of this scheme receive this food free of cost, not those 3 or 4 cents that were required to be paid are being paid by now as part of the scheme. The Government of India has stopped this scheme by the month of November. They won't be having this scheme in place from this month itself. But Uttar Pradesh has extended this scheme till March 2022. So Uttar Pradesh will be giving free food to 150 million people across its state till March 2022. So once you did that, you ensured the fact that livelihood was ensured. People will have enough of food on their plate to eat. And if you are implementing certain other guidelines beyond that, there is a higher likelihood that people will respond to those guidelines because of the fact that they have the livelihood on plate. They have the food on their plate. Now, of late, what Uttar Pradesh also did was that as part of this scheme, they would receive either rice or wheat as part of the scheme. So for example, they would receive, every individual person would receive 5 kilograms of food grains. So one person per month would receive 5 kilograms of food grains. Now to this, they have added the fact that they will also receive a kilogram of mustard oil or a kilogram of any other edible oil that they will need to cook food. So they will receive the food grains, they will receive the edible oils to prepare their meals. They just have to procure some amount of vegetables if they want to have food. So in that sense, Uttar Pradesh was able to extend more benefits than the entire country as such. But all in all, they were able to ensure the fact that people didn't suffer. They didn't die because of the fact that they didn't have food on the plate. This was another exemplary scheme in terms of, as far as India is concerned, extension of an already existing scheme in terms of its reach, horizontal, vertical, and in terms of the benefits it's able to deliver. The third scheme that we talk about, and that is something that we are very much interested, is in Mera Gaon Corona Mukt, my village Corona free. Now, this was again a part of a system which was not initially developed by the government of Uttar Pradesh. This was initially developed by some other government. Now, there's a state in the west of India which is known as government of Gujarat. Government of Gujarat thought of this scheme initially. They thought of having this Mera Gaon Corona Mukt scheme in place for the first time. But it was largely implemented across its length and breadth by Uttar Pradesh only, and they saw the benefits of it. Now, what they did under this scheme was that now Uttar Pradesh, as I said, is divided into 75 districts. Now, in addition to the fact that we have a federal government which controls the nation as far as defense is concerned, internal security is concerned, finances are concerned. Then we have the state government which take care of, for example, health, which take care of education, for example. Below the state governments and the central government, we have a system of local government system. We have a system which is known as local self-government. And under this local self-government, we have a system of Zilla Parishad, which can be called as a district assembly. We have a system of block panchayat, or which we can refer to as a group of villages which are headed by somebody who takes smaller decisions there. And then there is the village system itself. So we have a local government which controls a small part of what activity will be carried out in these villages, which may be in consultation with the state or the central government. Now, what Uttar Pradesh did was that they used this local government system to its advantage in implementing this Mera Gaon Corona Mukt. Now, under this local government, every village has a village headman. Now, this village headman is answerable as well as responsible for carrying out small works within the village. For example, he will take care of how sanitation process is working in the village, or how water supply is working in the village, or how cleanliness process is working in the village. Now, what they did was that they spoke to these village pradhans, they spoke to these village heads and asked them that we want to implement this Mera Gaon Corona Mukt in each village. And we want your support for that. We want your help for that. Now, once the help of these people was sought by the government, they went with two people who were already identified to take the process forward. Now, first person was an ASHA worker or accredited social health activist. Now, these ASHA workers are a part of ASHA workers in India is a system of paraprofessionals who take care of small healthcare needs, nutrition needs, sanitation needs of the village, are paid by the government of India to do these small work in consultation with health and other departments to generally create awareness or give feedback on how exactly health process is working, or how exactly sanitation process is working, or how other issues of the village are going around in the village. They're paid very small amount for that, are generally local people from the village itself. So they roped in these ASHA workers. Now, the state of Uttar Pradesh has around 150,000 ASHA workers to take care of, because of the fact that it has around 97,000 villages. It has around 150,000 ASHA workers. So that was a part of paraprofessional team. In addition to these paraprofessionals, they also took help of auxiliary nurse midwives. They are a part of a structured health system that we follow in India. If you look at the health system in India, we have the we have the tertiary care system, which is there in terms of the medical colleges or medical schools, what we refer to as medical schools in the West, medical colleges and medical schools. Then we have the district headquarters. District headquarters tend to have district hospitals, which are a part of secondary healthcare system. Then below the district headquarters, we have the sub-district hospitals or the community health centers, which are a part of the primary and at some points in time secondary healthcare system. Below these primary health centers, we have the sub-health centers. Now, these sub-health centers are actually expected to deliver preventive and promotive care at the lowest level. And each sub-health center is positioned to take care of a population of around 5,000 people. So generally, we see that a total of 5 villages form a sub-center. So a sub-center generally takes care of 5 villages. Now, these sub-centers are manned by these auxiliary nurse midwives or health assistant, male or female. So we have the health part taken care of by these auxiliary nurse midwives, and we have the paraprofessional part or the village health guide part taken care of by the accredited social health activists. So the two combined together, the A&M and the ASHA. Now, in places where they didn't have enough of A&M, what they did was that they combined 2 ASHA together. Or in places where they didn't have enough of ASHA, they would combine 2 A&Ms together. Now, this group of 2 or this team of 2, the A&M and the ASHA, went to the village. Now, because of the fact that the village heads were already sounded of the fact that they were embarking on this Mera Gaon Corona Mukt village, there was some level of awareness already in the village itself. So people were more or less aware of the fact that this is something that is going to happen in our village. Now, this team of 2 was given a few tasks. It was given the task of creating an awareness within the village. So they would go to the center of the village, ask people to gather around the village in open, and they will deliver a lecture or they will deliver a talk on COVID and the COVID appropriate behavior. How exactly COVID happens, how exactly COVID is transmitted from one person to another, how exactly can we prevent COVID from happening, how do we wear a mask, how exactly do we sanitize our hands, how do we do hand washing. So all this was taken care of under an awareness campaign, which was conducted by these 2 people, in addition to the village health headman within the center of the village itself. And this information was dissipated to everybody in the village. So that was one part of the process that this team did. The second part of the process of this team did was that they were carrying a card with them. There's a sort of a card which had some details on these, and they would go to each house and fill the details in those cards for each village, each house. So they would go to the house and ask the people, is there anybody in your house who has cough, for example, who has fever, for example, who is feeling fatigued, for example. So they basically did simple screening tests for everybody in the villages. And this was done across villages, all villages of Uttar Pradesh, across every family of the Uttar Pradesh. In a day, they would generally tend to cover at least 40 households. So if you look at the number of people they would cover in a day, it was around 200 people in a day. 40 households generally would cover around 200 people in a day. Each household, 5 to 6 members, 200 people would be covered in a day. So they would generally cover the entire village in a period of 5 to 6 days. So one village would be covered by one team in a period of 5 to 6 days only. This was done across entire Uttar Pradesh by teams which were constituted like this in all villages. Now, once they screened these patients, if they would have found that somebody was symptomatic or somebody was there and was responding in the positive to every question that they asked, they would immediately rope in the nearest health facility. So they would ask the nearest health facility that this is a problem that we have. We have a person who is complaining of symptoms of COVID. What should we be doing? So the nearest health facility would dispatch a team. They would undergo a test, which was generally done through rapid antigen testing. So the person who would turn symptomatic, he would undergo a rapid antigen testing, and if he was positive, and the symptoms were not of severe grade, he was asked to be isolated within the home itself. So he would be isolated within the home itself, and this ASHA worker was tasked to report to this person who was symptomatic and isolated in home on a regular basis. So she would report on this person on a regular basis. If the patient was sick, that he wanted to be shifted, he needed to be shifted, so he would be shifted to the nearest health facility. If the patient was asymptomatic, and had come in contact with the person who was symptomatic or who was COVID positive, again, instructions to these ASHA were passed on. How exactly did they ensure that this person was quarantined within the village itself? So the ASHA followed all the steps from beginning, from creating awareness to ensuring the fact that they are screened, to ensuring the fact that they are tested, to ensuring the fact that they are isolated, as well as quarantined within the village itself. So what they did was that, as I said, that the health infrastructure in Uttar Pradesh may not be of the same level that is there in Europe and America. What they did was that it prevented a large mass movement or mass scale movement of people from Uttar Pradesh's rural areas to its urban areas. So as I said, there are roughly more than 77% of people in Uttar Pradesh live in rural area. So if rural Uttar Pradesh was feeling the pinch of the pandemic, what they would do is that they would move to the secondary and tertiary care setup. And then they will not just flood these secondary and tertiary care setups, they will also carry the infection throughout the path that they follow to reach their secondary and tertiary care centers. They will be infected, and within their path, they will infect other people while they travel from one place to another. The fact that these teams would check on them on a daily basis because of the fact that they were locals was much more easier. Now, these teams also carried with them the pulse oximetry as well as thermometers. So now that they had identified that somebody was sick or somebody had turned symptomatic, they would go on a repeat visit and check for the level of SpO2, oxygen saturation in this individual. And if they would feel that this person was showing low oxygen saturation, they would immediately inform the nearest health facility that now this patient needs to be shifted. So using this screening test, using pulse oximetry and thermometers, they were largely able to ensure the fact that the person was taken care of in his home settings only and was also able to be reported upon more regularly than if he was moved from one place to another. As I said, because of the fact that they were locally available. The ASHA worker is generally from the same village wherein she works. So she had an idea of everybody who lives in the village. In that way, this entire 97,000 villages in Uttar Pradesh were covered from house to house, and people identified with chances of COVID-19. And if there was this chance of COVID-19, this could be reported. Now, within this chain, every report this ASHA worker would send, this report would go to the block medical officer. As I said, the officer who sits at the level of a CHC or community health center, the first treatment center or the first treatment or first curative center in the villages itself. A number of villages catered for their curative needs to a community health center. So the block medical officer sits there. So this report will go to the block medical officer. The block medical officer will compile the report and send it to the chief medical officer of the district. And then from the chief medical officer, it will go to the state authorities. So a chain was established wherein accountability of ASHA, accountability of block medical officers and chief medical officers was ensured in ensuring the fact that they were able to know of all patients that are there in the villages, as also of the fact that they were able to test, treat, and manage them in their homes if the need was there, or shift them if the need was there. So that was probably exceptional about this My Village Corona Free. Now, in addition to the fact that they embarked on this plane, they also had the involvement of, as I said, the village pradhans or village headmen into the system. So what they asked the village headmen that if your village is able to perform well, we will provide you some incentives. We will give you monetary benefits. As I said, small activities in these villages are run by these village pradhans or village headmen. They do for example, they have to open up a pond in the village. They have to create a pond in the village for water collection itself. So the funds come from the government of state government or from the central government. So what they said was that if a certain amount of money is being planned at this point in time for your village, that money will be enhanced if you do very well on COVID. So that was an additional incentive that was given to the villages. So the village headman was indirectly or directly involved in this process because of the fact that he wanted to ensure that his village was doing well. Because if this village was doing well, more amount of money will be funneled into the developmental schemes that will happen in the village. So that was probably one additional thing that was done in this My Village Corona Free. You will be surprised that this scheme was later on picked by Maharashtra. The scheme in entirety was picked up by Maharashtra, and they announced a prize of 5 million for the best performing villages. So they would, in addition to the existing schemes, they will give 5 million Indian rupees to the best performing village to carry out developmental works within the state. And it would not be an exaggeration. The number of cases started falling down in Uttar Pradesh from the day this scheme was, falling down in Maharashtra from the day this scheme was planned to be implemented in Maharashtra as well. And from a high of 8 to 10,000, initially from a high of 8 to 10,000, we started seeing the numbers falling down to 3,000, 4,000, and 1,000 recently. So in that sense, this scheme was very good and implemented properly. In addition, they also did certain other things which were not a part of Mera Gaon Corona Mukt. For example, they envisaged into a campaign which was known as Tara Hai Taiyar. Now, Tara Hai Taiyar in English means Tara is ready. Now, this was primarily fueled by the fact that Uttar Pradesh, as also the country, by the end of August and September, was thinking that we may be entering into a phase wherein we may have a third wave, and this third wave may be if not of the same magnitude that we saw with regard to our second wave, but maybe a large enough to impact our children to a large extent. So we were worried about the fact that a large number of our children may be impacted in this third wave. So to prepare for that third wave impact, which could have actually impacted children, they prepared this series Tara Hai Taiyar in collaboration with UNICEF itself. The Uttar Pradesh UNICEF, the government of Uttar Pradesh, prepared this Tara Hai Taiyar. Now, this Tara Hai Taiyar was a 10-episode series, the protagonist of which was a 7-year-old girl. So this 7-year-old girl would appear in this 10-part series over a period of time and talk about not just the fact that how exactly hands need to be sanitized or how exactly masks needs to be worn, but probably the most important aspect of this Tara Hai Taiyar was how exactly a 7-year-old relates to her parents on the impact of COVID, how COVID has impacted their daily activities, how it has impacted their livelihood, how they have been not able to procure their food the way they would procure before COVID. So all of that, and how stressful this is, the fact that lockdowns are there, or how stressful COVID itself is there. So that was probably more important than the fact that she was talking also about how to hand wash or how to use sanitizers. The fact that she was talking about the crisis as such was probably the highlight of this Tara Hai Taiyar. And this Tara Hai Taiyar was delivered in local language. It was delivered in Hindi and beamed across Uttar Pradesh on the national television in a 10-part series. In addition, a private channel in government, a private channel in India also relayed this on their private network. And this was said to be a huge success as far as its reach was concerned. So this was some other initiative that they took in addition to the fact that their focus on majorly was on Mera Gaon Corona Mukt, my village Corona Free. So that's something about Uttar Pradesh. But primarily what as I said in my primary, what I realized is that the strength of India lay in it having a strong public health infrastructure. Unlike the other parts of the world, over a period of time, we have not been able to kill it. We still continue to have a good public health infrastructure. And that was something that Uttar Pradesh leveraged, Uttar Pradesh used. Second, we had very good social service schemes in place. For example, this Antodaya Ann Yojana, wherein this free ration was distributed. And also the fact that Uttar Pradesh could leverage the strength of these schemes and think anew in terms of this My Village Corona Free. That's something probably worked for Uttar Pradesh. And that's why I said, if we could have thought of this scheme, probably in the first phase of the pandemic, we would have been doing much, much better than what we eventually did. Although, as I said, we did much better than most, but the fact that we did lose lives was not something that we should have ultimately. Thank you.
Yeah, would you say that there was any pushback at all from any amount of the population on some of the measures taken, like the e-pass, for instance? Was there any uproar or anything of that sort that happened from everybody, or did everybody comply reasonably well?
This is a question that I'm asked most often by
interesting.
No, not from India. This is a question that I'm asked most often by people from other parts of the world. Recently appeared in a Brazilian show. And again, they asked me the same question. How much of resentment did Indians have to lock down and other things? Trust me, at no point in time did we have a resentment to this. As I keep saying, primarily there are two things to it, and I told this to Brazilian people as well. Now, how do generally Indians react? Indians generally react on the basis of trust. Most important aspect of Indians' livelihood for living is the amount of trust they can have on people, or in beliefs, or in politics. So over a period of time, they were able to trust the fact that the leadership of India was willing to deliver on mitigating the impact of COVID. And these were necessary. These steps were necessary. You will be surprised that I had to travel. I continued to keep traveling to my parents, and they live in a different state. I live in a different state. I work in a different state, lived in a different state. They live in another state. Although we are separated by a distance of only 4 hours, but we live in different states. And I may have undergone a minimum of 50 RT-PCR tests till date. 50 RT-PCR tests just to ensure the fact that I reach my family. And I have never ever shown resentment. For example, my daughter, she has not seen school. She studies in class 9. She has not seen school since March 16th, 2020. So she has not gone to the school since then. She is staying home, doing her online classes. We didn't have a huge amount of resentment in any way when we rolled out vaccines, for example. When we didn't have resistance against vaccines. We did have problems with vaccines in terms that when the cases start falling down, people tend to think that, oh, this is over now. We don't need the vaccine. But we didn't have a resistance to vaccine. People didn't want to get vaccinated. When the cases start rising, people would come to us, flock to us, give us vaccine, give us the vaccine. So that has been there. But we didn't see a general resistance the way we see in Europe. I see it this way. Probably the problem in Europe or some parts of US is that there is a conflict between lockdowns and liberty. So if there are lockdowns, are we compromising our liberty? In our situation, it was a compromise between lockdown and livelihood. So we were worried about the fact that if we are going to a lockdown, if we are going into the restrictions, are we ensuring livelihood for our people? So once that part was taken care of, once it was ensured that the people will have their livelihood intact, it won't be lost, people will continue to have food, not just through government, but also non-governmental organizations. There were organizations which may have been able to provide food to 15,000 people in a day, free of cost. It was delivered to their home, free of cost. If they would get an idea that this person is sick, is not able to move around, has been quarantined or isolated in his home, he needs to receive food. So this has been done even by non-governmental organizations, not just government organizations. Because government organizations tried to reach out to most of the people who are poor, who were below poverty line. But there were also people who were above poverty line, but couldn't attend to their offices, were sick, couldn't prepare their own food. They also received food from some other agencies. The non-governmental organizations pitched in there. So I would say once the fact that it was ensured that people had livelihood in place, they were more likely to listen to the guidelines. They were more likely to follow the guidelines. We continue to have masks in place. You'll be surprised, even despite having myself being doubly vaccinated, I continue to use an N95 mask when I go to my office, when I go to my hospital. I continue to use, even when I sit in my room, which is there for me only. I continue to use that mask because if I go in my hospital without my mask, I will be asked to go back. You can't move around the hospital without a mask. That continues to be in place.
Would you say the key component to all the success that happened there was this focus on what was occurring on regional levels and trying to see successes within particular villages? Is looking at the local level was how much of a key factor do you feel that was in the successes that occurred?
Absolutely. I think the key is establishing a community connect and giving them the share of their success, transferring the share of success to the community itself. So once the fact that we told them that it's not the success of the government, it's not the success of the healthcare workers only, it's your success. If you are able to deliver on a COVID-free village, it's your success. You'll be surprised to note that. Now, once the numbers started falling in Uttar Pradesh, for example, the Chief Minister of Uttar Pradesh wrote individual letters to every village headman, appreciating his efforts in controlling the pandemic. And this was repeated through a message which was conveyed by the Prime Minister of India to village headmen. So the Prime Minister of India spoke about these village headmen and conveyed his regards to them for having been able to be successful in reducing the numbers. And the Chief Minister of Uttar Pradesh sent them letters, personally wrote them letters that I'm thankful to you people for having helped us in getting rid of this or reducing the numbers in the pandemic. So probably when you give the credit of the success to everybody who is involved in the process of mitigating the impact or reducing the impact, you are probably more likely to ensure success. Now, again, if the Prime Minister of India goes on a Man Ki Baat. Man Ki Baat means what I want to speak from my heart. So he has a show which is broadcasted on radio where he talks about his own feelings, and he communicates on COVID to everybody. He talks to ASHA workers. He will talk to the A&M. He will talk to the village headmen. He will talk to the doctors. He will talk to everybody. So the fact that he is communicating to the most basic level of healthcare workers, and not just healthcare workers, others who are contributing in the process itself. He will talk to the police people. He will talk to the people who clean the streets and talk about COVID to them. You are thought to be a part of the process, and once you think that you are a part of the process, you tend to share success, and you tend to want to be successful and be part of the shared success itself. So that may have helped in its success itself.
Do you think any of these methods could be utilized elsewhere in the world, or not? Could it? Do you think it's quite possible that anywhere else in the world would utilize that, or do you think it's going to be refined to India?
Again, the same question that was asked by people from Brazil itself. What I would say is that I keep saying this: this pandemic has been a master class in a sense. It has come to us at a cost which it should not have. We have lost a lot of lives. We should not have learned a lot of things at this cost, but we did eventually lose a lot of lives. But it taught us a lot of things. One thing it taught me, for one, was that having money in your hand or having an advanced technology in your hand is not going to prevent pandemic. And it's not going to take care of pandemic. Or in other words, having a resource-rich setting is not going to deliver the best healthcare models. It's the other way around. It's the resource-poor settings which will deliver more sustainable models which can be implemented across the world. Now, if I look at Indian model now, you may not find it very easily implementable in Europe, but Europe constitutes a very small population as far as the world is concerned. And Europe has enough of money to take care of itself. Probably that's the way I think it. But the Indian model is replicable across all low and middle income countries. We have seen the success of Ebola in Africa, for example. Same community connect was done by people in Africa when they wanted to get rid of Ebola. So this can be replicated in all low and middle income countries. Across Africa, it could be replicated in Brazil. I have shared a model with them in my talk with them, wherein it could be replicated in Brazil itself. So a large part of the world which are like us, and most of the countries in the world are like us. If not in terms of the numbers, but in terms of the population, most of the people around the world are like us. They are all low and middle income. They are not rich people. So they will all benefit from this model. So this model can be implemented across most of the settings in the world, because this is not a model which is very costly. It is a very simple cost. It's very cost sensitive. There's not a huge amount of money that is required. It's just that what you need is that you need to put those processes in place, and these processes can be put in place easily. It's not a big deal to do.
Well, let's leave it there. So thanks so much for coming back on again, and it was great to talk to you again.
Thank you. Thanks a lot.
Thanks for listening to the show, everybody. There'll be more episodes coming for you in the future. Be sure to check out endcoronavirus.org and worldhealthnetwork.global for more information on the organization. Thanks to Michelle from Make Good Together for doing the graphics for the show, and a huge thanks to Tracy, the noble producer of the show. If you listen to this show on either YouTube or podcast format, well, they are available on both, and be sure to like and subscribe and comment on those. All the best. Until next time.